Now you'll notice that there is actually a nice papilla underneath the inflamed tissue, so we don't want to go between the teeth. We've got no diastema here. We just want to remove this bit of tissue and then make it more apically positioned. So just freeing up the tissue again, and now I'm just going to get a little probe and just make sure that the tissue is free underneath both edges of the flap. You can see that the tissue, as soon as it was released, the actual frenum itself just immediately slides up. Now that little papilla we just snipped off because it just wasn't going to lay flush with the other tissues. It would have left a little tiny bump on the tissue. I've left the actual papilla on the frenum before and it never really heals that well. The problem with frenums is that they're very easy to remove, but they're also very easy for them to grow back. So if you're not careful, you can end up with the frenum reappearing. So there we're suturing both sides of the frenum to the underlying tissue in this particular area so that we can get it to be quite stable there and to avoid it reconnecting. Now I thought that 2 sutures would be enough, and then I thought nope, that little piece there is still a little bit immobile, a little bit mobile, so we will suture it down, and you can see that I've gone through that little piece of tissue, but then I've re-angled the needle to engage that tissue deep up underneath the flap there. So because when I tie this one, I don't really want to pull that tissue down towards the crowns. I just want to secure it to the underlying tissue. I mean, some people say they're suturing to the periosteum. It's actually very difficult to suture to the periosteum. You're probably just suturing to the tissue over the top of the periosteum. Now the reason I'm using dissolving sutures here is because this is not a particularly fine bit of grafting as such, so we don't need the super fine sutures, and nor do we need to maintain the soft tissue in such a definite area for so long. Now the crucial part when tying sutures is to pull the tail. So you see the tail was on the right, and now we're pulling it to the left as the knot gets laid. So if you don't pull the tail to the other side of the knot, especially during the first knot, the knot of the suture won't lay flat and then it won't lock.